Patients suffering from heart diseases need to take proper care of themselves during summer. That is what you will understand in today's video. First of all, understand one important thing. Summer is not just about heat. It is also a time when extra stress is placed on the heart. As the temperature rises during summer, the body relaxes its blood vessels, keep itself cool. Because of this, blood pressure may fluctuate and the heart may have to work harder. In addition, excessive sweating causes loss of water and electrolytes from the body. And if the body becomes dehydrated, proper blood circulation to the heart may get affected. As a result, symptoms such as fatigue, dizziness and increased heartbeat, shortness of breath or chest discomfort may occur. That is why hydration is very important. But for heart patients, simply drinking more water is not the right solution. In some patients of congestive cardiac failure, increased hydration, increased fluid intake may increase swelling all over the body and it may cause severe heart attack. Therefore, it is very important to maintain fluid intake only as advised by the doctor. Now let's talk about diet. During summer, people always consume packaged foods, packaged drinking water, packaged cold drinks, oily and fatty food, but these contain high amount of sodium, high amount of sugar, monosodium glutamate, various preservative acids and unhealthy fats which can be harmful to the heart. For heart patients, a low salt diet, light and easily digestible food along with fresh fruits and vegetables is very important. Daily salt intake should be limited to 2 to 3 grams per day. Potassium intake is also curtailed when the kidneys are compromised. The third important thing is electrolytes. Sweating reduces sodium and potassium levels. This can affect heartbeat. If symptoms such as sudden weakness, muscle cramps, irregular heartbeats or excessive sweating, severe weakness appear, they should not be ignored. Excessive sweating, swelling on legs, arms or face or generalized anasarca or generalized swelling, it should not be ignored. Another important thing is to avoid excessive heat exposure. Walking outside during the afternoon heat at 12 to 4 p.m. can increase stress on the heart. So, it is advisable to venture out primarily during morning and evening hours and protect your head while stepping out in the sun. Always use light colored cotton loose clothes. Keep your place ventilated and cool. Your daily protein intake is of paramount importance. It should be 40 to 60 grams per day. Your weight into 0.8 is equal to your daily protein intake. If you have 50 kilo of weight, then multiply into 0.8. The figure should be 40 grams per day or more. If you are a non-vegetarian person, then you should eat fish and eggs. The eggs should be whole, white and yellow. If you are vegetarian, then you have to eat vegetarian proteins like pulses, germinated pulses, soya bean, paneer, etc. You have to eat leafy vegetables, fruits with low sucrose like pear, guava, apple, etc. Also consume natural healthy drinks like coconut water, lemon juice, pomegranate juice, buttermilk, watermelon juice. If your potassium levels are low, you should avoid food, leafy vegetables and fruit drinks if your potassium levels are high. And the biggest mistake people make is stopping medicines once they start feeling better. Heart diseases are chronic and progressive. They can continue to worsen slowly from within. That is why taking heart medicines and homeopathic medicines regularly is very important. At modern homeopathy, we have often observed that within a few months of starting treatment, patient begins to feel improvement in their symptoms and in reports also. Their palpitations reduced, stamina improves, and they feel that they no longer need treatment. Patients stop treatment on their own. But this is where the biggest mistake happens. If treatment is stopped midway, the condition may worsen again and serious complications may arise. That is why we always advise patients to start or stop treatment only under modern homeopathy's expert medical guidance. At modern homeopathy, treatment for heart diseases does not focus only on symptoms, but also works on circulation, internal imbalance, and overall heart functioning. This modern homeopathic curative line of treatment has been personally researched and developed by me, and it is completely scientifically developed and proven. Over the last 30 years, at modern homeopathy, we have successfully treated more than 2,15,000 patients of serious and grave illnesses. Our only goal is to provide safe and effective treatment for heart diseases and help all patients suffering from chronic diseases to live a disease-free and healthy life. The medications utilized in modern homeopathic system are entirely organic and devoid of any adverse side effects. Our services are available at clinics located across India and worldwide. All practitioners working under modern homeopathy